Let's talk about how will you know that someone is having myasthenic crisis or cholinergic crisis. How will you know? How will you find out? If today is your first time of hearing about this, relax, we're gonna talk about it. Let's talk about the test, the procedure that you will use to find out if someone is having myasthenic crisis or cholinergic crisis. Okay, there is a test that is used to detect if someone is having myasthenic crisis or cholinergic crisis. This test is performed by neurologists to diagnose myasthenia gravis and to differentiate between myasthenic crisis and cholinergic crisis. Let's go. Please pay attention because this is very important information, and Chris will test your knowledge based on this topic. Please help me out to share this information, like and comment. Remember, as you're sharing this information, you are saving life. There is something that you need to know before this test. This test can put a client at risk of ventricular fibrillation, VFib, and also cardiac arrest. So before you start this procedure, before you start this test, you have to make sure that there is an emergency equipment available in case if there is any life-threatening condition during this test. How to diagnose myasthenia gravis using the test with the medication called tensilon intravenous. Client shows improvement in muscle strength after administration of this particular medication called tensilon. It is called positive, which means that person has myasthenia gravis. But when a client shows no improvement in muscle strength, and even the strength may even deteriorate after receiving the injection called tensilon, which means that person does not have myasthenia gravis, it is negative. Okay, how to differentiate the crisis, myasthenic and cholinergic crisis. When giving this injection in myasthenic crisis, when administered this injection, if the strength improved, if the muscle weakness improves, the client needs more medication, which means that client is having myasthenic crisis. More medication is needed. Then, how will you find out if someone is having cholinergic crisis? After administration of this medication, there will be a severe muscle weakness, which show that there is an overmedication. The patient has been overmedicated. Please prepare to administer antidotes, which is atropine. Prescribed antidotes, prescribe atropine, because there is an overmedicated medication. That is why this person is having cholinergic crisis. As you can see, you can easily and simply differentiate between myasthenic crisis and cholinergic crisis when there is a medication, the strength, the muscle improved, there is an myasthenic crisis. They need more medication. Then, when you give that test, the muscle become more severe, the muscle become weak. It shows that there is an overmedication, which is cholinergic crisis, which needs an antidote, atropine. So guys, please, I will stop here for now. Remember, awareness is the key. Do not get it twisted. Help me out to share this information, like and comment. See you guys in my next video.